Every time I see the van comes, I always come to the van.
Hey, good afternoon. How can we help you today?
Things are more extreme here on the street, but there's great satisfaction you can get from helping people, and people are very appreciative, you know.
Doing this work is so rewarding. You know, you learn so many things. You'll see things in the hospital, in clinics that you think you've seen everything, and you haven't. You get a feeling of you've accomplished something as well as they've accomplished something. You help them.
It's really important to me to help people. I want to be able to give back to the community, and I feel like this is a really great fit for that.
If I could thank anyone in this organization, it would be the whole entire team, the whole crew that comes here, because everybody treats everyone with respect. Everybody treats anybody that comes with respect, and they're so, you know, they're soft-spoken and they're all right, you know. They treat people good.
Introducing me to a lot of the issues that homeless residents go through, so that when I do see them in the hospital and when I see them in clinic, I'm more prepared, and I have a better skill set with helping them with the different issues that they go through. Just today we treated someone with a hand infection. I had to give him a warning, you know, if this doesn't get better with the antibiotics we give you, then you'll have to come into the hospital. But it was a good way to see if we could meet him where he was at, because he didn't feel comfortable coming into the hospital, and we were able to give him some advice and some treatment right there on the van.
All of our Pop-Up Care Village exit surveys show that they're incredibly grateful for the services that the SOS van provides.
All of the clinics in the San Francisco Clinic Consortium really do focus on behavioral health and addiction issues, and so we've worked together very closely, ensuring that we have not only those within the system of care of the primary care system, but those who need more ongoing care in terms of some of our hospital services and some of our specialty services. We work very closely with the Clinic Consortium to ensure that we're all coordinated in providing the best care for individuals in San Francisco.
From your heart, you can see that it's necessary to help people that are in need and that not only want things, but they need to have these services. You know, they need to have dental, they need to have medical care, they need to have counseling, they need to have the whole laundry list of things that are available at their disposal once they get into the system as homeless people in the Healthcare for the Homeless programs that is available through SFCCC.
SFCCC formed in 1982 when the San Francisco community clinics came together to form a single organization that allowed them to aggregate their voice in terms of advocacy for our low-income patients throughout San Francisco. We were fortunate enough, 6 years after forming, to get the federal Healthcare for the Homeless grant. And that grant helps us bring additional dollars into San Francisco to care for this neighborhoods that we serve and the homeless patients throughout San Francisco. We have a mobile van that has been in commission with the San Francisco Community Clinic Consortium for the past 30 years. We have provided care throughout the streets of San Francisco, meeting our patients where they are, which may be in homeless encampments, under bridges, on street corners, and through our van, as we're out and about meeting patients for their urgent care needs, we then treat the urgent care needs but refer them to all of our member health centers and to the San Francisco Department of Public Health for ongoing care for preventive services.
The San Francisco Community Consortium clinics, which are a big part of our provider network, deliver outstanding care to our members.
Everybody needs this stuff, and it's just not that easy just to go get it, you know? And they're willing to give it to you. They'll even come out and look for you, man. They come out, if they know certain places that you hang out or something, they'll come out and walk around and look for you.
Our experience with the Street Outreach Services, SOS, has been amazing. We love partnering with them to offer services to people at our co-location, Martin de Porres.
I think we save lives, and what can I tell you? There's so many instances that I think that the antibiotic at the right time, they refer them to take you because you're about to break down, because you're feeling very depressed and you're almost suicidal.
I would highly recommend other doctors and nurse practitioners, nurses to do this as well, because I think you know, an experience like this, you get as much out of it as the people that you see, you know. I mean, this teaches you sort of humanity and patience and taking people, working with them on their terms.